happy to have you all here. Today we're going to have a few presentations by our governing board president, our superintendent president, and our vice presidents as well, and then also give you an opportunity to ask Q&As. The question and answers are available down at the bottom of your screen, so if you have any questions at all, please go ahead and submit those and we'll answer those as they come in. In addition, if you would like closed captioning, please feel free to select that down at the bottom of your screen so you can have closed captioning. Let me thank, as we start here, our ASL interpreters, Katura and Morgan. Thank you so much for being here and making this an accessible space, as well as thank you to our captioner, Danielle, for being here with us as well. So as we get started, again, a reminder to go ahead if you have any questions and answers as we go along, please submit them at the Q&A button at the bottom of the screen, and we will have a Q&A period at the end of the presentations. So thank you all so much again for being here, and with that, I'd like to bring to you Governing Board President, Leticia Cáceres. Please let me stop sharing, and here you are. Welcome, Leticia.
Hello, Southwestern College community. I'm happy to be here today with all of you as we begin planning for our phased reopening in the fall. Thank you to Dr. Sanchez, our reopening working group members, and college leadership for planning so thoughtfully and prioritizing the health, safety, and well-being of our students and employees. I want to recognize any of my colleagues who are here today listening. Thank you to Vice President Roberto Alcantar and Trustees Griselda Delgado, Don Dumas, and Karen Macapugai for being here. Before turning it over to our Superintendent President, I want to say thank you to all of our employees and students. This has been a year. And although many of us feel like we are hanging on by a thread, I want to recognize and thank you for the hard work, long hours, and sacrifice you have all made to ensure our students have what they need to succeed this year. Thank you, thank you, thank you. And now at this time, I will pass it over to President Superintendent Mark Sanchez to begin sharing important information and starting our discussion.
Thank you, Board President Cazares, for your encouraging words. And thank you to everyone who is participating today in our reopening town hall. Our decisions around reopening impact everyone, and therefore everyone should have a voice in the process. Your participation is important. It was more than a year ago that Southwestern College moved to 100% remote learning and operations. The college moved quickly to ensure the health and safety of our employees and students as COVID-19 spread and disproportionately impacted the college's service area. From the beginning, college leadership based all decision-making on student and employee health and well-being. In looking at the case rate fluctuations over the past year, I am certain the college would have seen an increase in campus spread cases of COVID-19 had it not acted responsibly. Z, can I have you please move to the next slide? Since March 2020, we have kept each other safe by following scientific and public health guidelines. It has not been easy, and I recognize that many of us feel like we are barely hanging on. Our students, our faculty, our management, and our classified professionals. Yet we have and continue to persevere because we are a college that centers all our decision-making on creating a safe and supportive learning environment for our students. I want to thank our Safe Reopening Work Group, who has laid the foundation for our safe reopening by developing a data dashboard, tracking local COVID-19 data, particularly the data in our service area, developed an institutional safe reopening plan, and a program/departmental safe reopening checklist in preparation for the college's phased reopening. We have found many ways to meet the needs of our students, whether it's technology, housing, mental health counseling, food, or financial aid. We have ensured our employees were equipped with the tools they needed to be successful working from home. And we have ensured our campus was available to our community for food distributions, election polling, and COVID-19 vaccinations. Next slide, please. Throughout this year, we have watched as public health guidelines continue to evolve, as scientists learn more about this novel virus, and as new research studies are released. A year into the pandemic, and researchers are beginning to understand more about how COVID-19 is spread. We know it is primarily spread through the air and not from surfaces like originally believed. And we now have vaccines that have proven to be significantly effective in the 6 months since they've been implemented. So much so that scientists believe that they will continue their efficacy for at least 12 months. With the increase of vaccinations, California will move from a tiered reopening system to a full reopening beginning June 15th, 2021, should vaccinations continue to be readily available and hospitalizations continue to be low. Southwestern College will not be fully reopening with the state. We are choosing to be cautiously optimistic and plan to begin a phased reopening in the fall 2021 semester. We will continue to prioritize the health and well-being of our students and employees by following the public health guidelines required of us by the California Department of Public Health, Cal-OSHA, the San Diego County Department of Public Health, and the recommendations of the Centers for Disease Control, the CDC. Our students in our community are ready to return to Southwestern College, and we will be ready to receive them on a scaled capacity this fall. Next slide, please. I have invited our assistant superintendent and vice presidents to share with us how we will return in fall 2021. We will begin with Dr. Minus Bradley, our ASVP of Academic Affairs. Dr. Spradley.
I apologize, muted as always during Zoom. Good afternoon, colleagues, Southwestern College, members of the community. We at Academic Affairs are very excited about coming back to work. As a matter of fact, you may recognize the fact that I'm already in my office. We will be doing a phased return. After consultation with our deans and faculty, about 20% of our courses are coming back face-to-face. This includes approximately 482 classes. Of those, about 342 are on the Chula Vista campus. The rest are at Otay, National City, and Crown Cove. The list will be finalized in the next couple of weeks and published for everyone to see. Otay and National City campuses have been operating since last June. The number of classes they will be offering will expand. All of our centers, including San Ysidro, will be open to provide services for students. We're just not offering any face-to-face classes at San Ysidro. Next slide, please. Our classes will be returning at full capacity because we are assuming that in the fall, there will no longer be as many social distancing requirements, etc. With that said, any mask or social distancing requirements will follow CDC guidelines. When possible, courses will be spread out in classrooms, such as spaces can be cleaned on a regular basis. We understand that certain classrooms, for example, laboratories or studios or music courses, anything that uses equipment may need to occur in a specific room, and we have made allowances for that. Lecture classes will be spread out, and all of our classrooms will be cleaned on a regular basis. Next slide, please. We will also be returning library services in person, tutorial services in person, and there will be test proctoring in person. All of these will be available at limited capacity. Our Child Development Center is reopening also in limited capacity, mainly to offer 2 classes that our students need in order to finish their degree, but there will be reopening. Uh, that is all that I have in terms of academic affairs returning. Next, we have Dr. Tina King, VP of Student Affairs.
Good afternoon, colleagues and members of the community. I will be sharing the Student Affairs reopening protocols. The Student Affairs Division will be following the district's phased reopening plan to align with the course offerings and the needs of our students. We are returning in the fall by on-campus and remote services. Our Student Affairs and services operating hours will be Monday through Thursday, 8 a.m. to 6:30 p.m. in person, and Friday, 8 a.m. to 3 p.m. remote. Student services will be provided at all campuses. Next slide, please. Each department has submitted a safe reopening proposal that is being reviewed, sorry about that. That is being reviewed and vetted to ensure safety protocols are followed. Specifically on the Chula Vista campus, the Cesar Chavez building, Student Center, Personal Wellness, Equity, and Dreamer Center buildings will be open indoors. For the Cesar Chavez building, due to the size of the building, we will be regulating with an in and out system. The Welcome Center will be moved to the front of the buildings to regulate students entering and exiting the building. MERV 13 will be installed in the Cesar Chavez building, and the building will be closed twice a day for students only for deep cleaning. In order to ensure that we have the capacity to serve students and operate safely, additional personnel will be hired to support the reopening phase. Next slide, please. I want to share a few updates on the return and areas that we have had a lot of questions about. The district will be purchasing plexiglass for use where social distancing is not possible. Faculty will be in the class or office with students if they choose. Employees in student affairs will rotate working on site and from home to ensure physical distancing is adhered to in offices. We are creating an FAQ to answer questions that we are hearing most often. We'll be creating an FAQ for students as well. Next slide, please. Vaccinations. All students must be vaccinated to be on campus. We are creating an exemption process for medical exemptions and religious beliefs. The exemption protocol is being designed and will involve an alternative of regular self-testing. We are aligning to the State Department of Health that is requiring at least twice a week. How we plan to ensure that students will be vaccinated or opt into the exemption process is that we'll have screening and checks will be conducted at our welcome back check-ins. Also, we'll be using technology platforms such as ServiceNow for students to upload their vaccinations or their test results, and we'll be using QLess for appointments. Next slide, please. We're opening a self-testing site, which will be located at the Chula Vista campus. The self-testing site will be operated by health services and additional hires to ensure we are fully staffed. We'll be implementing antigen testing and PCR confirmatory testing. I've also connected with the deans of our centers to provide a list of free self-testing sites at community-based organizations that are near all of the centers or our students and employees' homes. These are offered by San Diego County. Next slide, please. As shared, all students will be asked to follow the safety protocols that the district enforces. Students who are non-compliant to rules will be addressed as a student conduct issue and will be asked to follow Administrative Procedures 5520. Next slide, please. Students will be allowed on campus if they have classes or utilize services. As shared, the college is looking at a QLess technology platform. All services will be offered on appointment basis only. However, we know that students taking class on campus may not always have an appointment pre-scheduled, so we will fill on-campus appointments at 80% daily, leaving 20% for our on-campus students to schedule appointments on the spot if needed. QLess will be used district-wide for student appointments. Next slide, please. We're currently open with our outdoor student study space, which will continue to be open in the fall. The purpose of the outdoor study space is only for students who need a space to attend class or study and will be provided by appointments only. We will follow health order, capacity, and protocols, health and safety order to eliminate overflow of capacity, and will follow all safety protocols. Cleaning will be provided during window times for the student study space. And off-site instruction at high schools are following the high school safe reopening plans and protocols. Next slide, please. So the next two slides I want to preface with, this is what we are planning now, but as the state and county restrictions are lifted, we will continue to reassess our plans. I also like to thank our support of the Enterprise Services and Center Civic for leasing. We've partnered together to ensure that the students' welcome back check-ins are robust and safe. For our student welcome back check-ins, they'll be located in Lot A for the drive-through. There will be 4 lanes open during heavy peak times and will be open Monday through Saturday. Students will only be allowed on campus if they have a class or an appointment scheduled. The student drive-through welcome back check-ins or walk-up check-in protocol will include the following. Students will be asked to identify the purpose for visiting the campus, temperature checks. Students will provide their vaccination card by uploading to the ServiceNow app being designed by our IT team, or students will provide negative COVID-19 test results that will be taken within 1 week of the date that they appear on campus. Students will show clearance for COVID daily questionnaire that is being built by our IT team as well. Next slide, please. Drop-offs or students who use public transportation will go through a walk-up check-ins behind the bus stations, which are adjacent from Lot A and near the wheelchair access ramp. Walk-up students will go through the same protocol as the drive-through check-ins. Next slide, please. Requirements and protocols will be communicated directly to the students through direct emails and lots of social media postings. Our cross-border students will be required to adhere to the same protocols as all students. Thank you all for your time, and I'll turn it over to my colleague, Dr. Kelly Hall.
Thank you, Dr. King. So our facilities professionals are currently working on site, and they have been since January, so they'll continue to do so. We will have increased custodial support. We are currently recruiting a custodial supervisor and 2 full-time custodians, and we plan to bring on up to 6 hourly custodians in order to assist with the extra cleaning that will be necessary. We have been in the process of updating and performing preventive maintenance on all ventilation systems in the district for a couple of months now. Any necessary repairs are being identified and addressed, and MERV 13 filters will be installed. Many already have been, but will be installed in all district buildings by the time we return to campus. Plexiglass will be available according to the Cal OSHA guidelines if it is in the reopening plan for your area. Cashiering. So our on-site, I'm sorry, let me make sure I'm on. Yep. So cashiering. So our on-site services will align with other Cesar Chavez hours beginning in August. We have a small cashiering team, and we will be requesting that they return to work 100% of the time, but offering flexible scheduling on a case-by-case basis. Campus police services. So we have currently 6 recruitments in progress. And so these are replacements for employees that have separated from the district in the last few months. So right now we are fairly short-staffed, but we will be hiring 6 part-time public safety assistants to assist at the centers, both morning and evening shifts. So there'll always be coverage there. The campus safety officers that are currently assigned to the centers will be scheduled on the Chula Vista campus when the semester begins and students return here. Our campus police operating hours will be Monday through Saturday from 5 a.m. till midnight until staffing levels return to normal. Purchasing, procurement, warehouse. So our purchasing department will be returning to campus operations as they're able to safely social distance. Warehouse, print shop, central services will be open to serve the campus community Monday through Friday from 8 to 4:30 p.m. We'll have the employees in those areas alternating the days that they're at work in order to maintain safe protocols. Our payroll department has elected to continue operations remotely. They can do so very effectively. They work in a building that's small with close quarters, and there's 0 to very little walk-in traffic or customers. So we feel like there won't be any loss of service or efficacy from that department staying remote. Our finance office will return to campus beginning August 2nd. We're offering flexible staffing to our professionals in that area. Some will be remote, some will be on site, and some half and half or partial. Next slide, please. So our bookstore will continue to serve students in multiple formats. We will have online ordering. The district is going to continue to cover the cost of shipping through our relief funds. We're also going to have in-store shopping 20 hours a week, mornings on Mondays and Wednesdays, afternoons on Tuesdays and Thursdays. And we'll continue with our very popular curbside pickup in parking lot H. And so when students place their orders, they select a delivery option. And if they select curbside pickup, their books are available in parking lot H by appointment or during posted hours. For food services, the Timeout Cafe and Trade Winds will return to food service operations. We'll be doing grab and go, completely sealed food, and you'll be able to order through a new app, and we will have outdoor seating or to-go service only. So we'll be open Mondays through Thursday with a limited hours on Friday. Pools and fitness clubs. So we at this time are pending governing board approval for a plan to reopen the fitness club, and we will be taking that to our governing board on May 25th. So pending board approval, we plan to reopen the fitness club, including the swimming pools, for district employee members in October. That will be the beginning of a phased reopening. And we hope to open for the entire community late in the fall semester. Meanwhile, the swimming pools will be open during summer for enrolled students, those students enrolled in summer school, and our athletes who are engaged in our organized conditioning and training activities. We'll also, the pools will be available for community leasing beginning in July when they're not being used for district programming. All of our facility leasing will return in the fall, and external groups will be required to submit a safety plan that is aligned with the district safety protocols as part of the leasing application process. So last is employee and visitor check-in. So our employees will be using the H Street entrance as we'll be reserving the two front entrances for our students. Employees with vaccinations on file will be issued a dashboard placard, and vehicles displaying this placard will be waved in. Employees with a medical or religious exemption will undergo on-site antigen testing twice weekly and symptom checking upon entering campus. These same requirements will be in place for visitors, non-student visitors. So the student visitors will be handled in the manner described by Dr. Keene. The only exception to the visitor check-in will be for vendors who are going to be on campus for 15 minutes or less. For example, UPS drivers, et cetera, will not be checking vaccination status on individuals that fall into that category. And that's all I have for you. So next, it's my pleasure to introduce our Executive Vice President of Human Resources, Rose Del Guadio.
Thank you, Dr. Hall. And good afternoon, everyone, colleagues and community. It's a pleasure to be here today. So as many of you have heard already, our faculty will be returning on opening day, August 20th. But for those who decide to avail themselves of the optional flex activities, they may be returning on August 18th or 19th, and those activities will be held remotely, as well as opening day. In terms of classified and management, the return date is August 2nd. Management will be returning 100% back on campus with flexible scheduling, as determined by direct conversations with their supervisor. Classified will return on a rotational basis, which means on and off campus in alignment with business need, as determined by their supervisor. If anyone should have any COVID-related scheduling concerns, please do discuss those with the supervisor, and it is hoped that we can find a solution to that issue. There have been some questions around telecommuting. For example, can I telecomute? Can I continue to telecommute 100% after we reopen. At this point, we are not able to do that. We are going to have a mix of returning on campus and working remotely. One of the things that the district envisions doing into the future is designing a telecommuting or remote working policy whereby those types of decisions will be able to be made. Next slide. Vaccine. Our vaccine policy on behalf of employees recognize that we're in the process right now of vetting a vaccine policy, not only through the unions, but of course through our shared consultation council. Please take note that the vaccine requirement will not be required until we have full FDA approval. Once that is in place, we will be, as a district, requiring vaccines of our employees. And as Kelly mentioned earlier, of our visitors, of our students, etc. There is an option for exemptions related to medical or religious, sincerely held religious beliefs, practices, or observances. We will have a process to submit for that, and it will require that individuals engage in an interactive accommodations process. Should you be approved for such exemption, it will also require you to undergo testing twice a week. You're going to have to mask up, and should any antigen testing come back positive, you'll also be engaging PCR testing. So for exemptions, I'm going to ask that you contact Ruby Ayala, our workers' comp specialist in human resources. Also, we are encouraging employees to obtain your COVID-19 vaccine no later than June 15th, and that's so that you can be fully vaccinated by August 2nd. Obviously, we all know that if you're taking a 2-dose vaccine, it takes at least 5 weeks to go through the process. So we highly recommend that you undertake this process at this point so that you can be ready on August 2nd. We will have a vaccine verification process for our employees. We anticipate that option to come through ServiceNow. IT is currently in the process of designing that app, and as soon as we have it ready, we will be notifying our employees on how you enter your own vaccine verification. So stay tuned on that one. Next slide. Okay, let me just give everyone a reminder. While it's fabulous that we have the vaccine and there's been a lot of efficacy around the vaccine, let me just remind people that should they experience any possible COVID-19 symptoms, first, the one thing we certainly want you to do is not come to work. So should that be the case while you're at home, please do not come to work. Should you be at work when you think you are experiencing some symptoms, we're going to ask that you immediately leave. And of course, we're going to ask that you get tested, stay home and away from others. At the same time, we want you to self-report to your supervisor, and the supervisor should contact HR immediately, and the person in HR to contact is Angela Riggs. And that will help us engage in contact tracing protocols. Hopefully we're not going to have to go down that road, but should we do, we have our own processes that we need to engage in on behalf of contact tracing. So know that we do have that process, and we will ensure that we undertake it should there be a positive case on campus. Next slide. Okay, so there are options for leave should you need to take leave. With SB 95, SB 95 provides you through September 30th, 80 hours for the purpose of caring for yourself. So for example, if you need to quarantine or if you're sick, you have up to 80 hours fully paid through SB 95. Same thing goes for a family member who may need to quarantine or is also sick. You can also take the 80 hours for that purpose. There's also the option if you're caring for a child whose school or place of care is closed due to COVID-19 on the premises. And lastly, you have the option to undertake paid leave if you are attending a COVID-19 vaccine appointment, or if you are experiencing COVID-19 vaccine symptoms that prevent you working on campus or teleworking. And lastly, should you exhaust those 80 hours, you still do have your collective bargaining contract leave, so you can always avail yourself of those. Okay, next slide. And this is now back to Dr. Sanchez, so thank you very much.
We are actually going to go into questions and answers right now before closing remarks. And so I'm going to stop sharing my screen, and I believe all the panelists are going to get pinned in Spotlight so that you can answer any of the questions that come. We'll be able to go from each of you. So Janelle, you and I are going to go back and forth, correct?
Yes, that's correct.
All right. Do you want to get us started?
Yes, and thank you for all of those who have submitted your questions online. So looking at that first question here, we're going to pull one from the submissions. So the first question reads, will exercise and swim classes be available? Can we use the pool and exercise facilities, assuming we are fully vaccinated? So I'm going to ask both Dr. Hall and Dr. Spradley to address that one.
So I can give that one a try. I did speak with Dean Spillers recently on that. So there is a plan for some swim classes to be scheduled over the summer, and exercise classes in the fall, wellness and exercise classes in the fall. So students will have access to our facilities in connection with those classes. As far as the fitness club, as I mentioned earlier, that facility will be reopened in phases pending governing board approval on May 25th. And we hope to welcome the entire community back by the end of that semester. So yeah.
Thank you, Dr. Hall. We have a submission in the Q&A here. Thank you, Jason Hums. It reads, will the personnel that will be doing student entry screenings in the fall start sooner to support Higher Educational Center at Otay Mesa during the summer, or will this remain a faculty responsibility? Dr. Spradley?
I'm working with both of my deans at the Higher Ed Center to determine the number of personnel we need. And as soon as we get everybody hired, we will relieve others of that duty.
All right, thank you, Dr. Spradley. Looking at another question here, we're constantly referring students to different offices. But if we use an appointment system, are students going to be turned away and asked to come back? Dr. King, I'm wondering if you might be able to respond to that one.
Yes, thank you so much, Janelle. That's a great question. So we're going to be investing in QLESS, and QLESS is a software, an appointment software, which would allow students to wait in a queue. Students will not be turned away. Our plan is to book appointments at 80% capacity. So those students who have walk-ins have the ability to take up the additional 20%. Again, we're going to be using QLESS. They'll have appointment base, and then it'll queue them when it's their time for their appointment.
Thank you so much, Dr. King. We have a question here in the chat. It reads, thank you, Claudia. If we experience symptoms such as fever, can we work from home during those days? Rose, would you like to take that one on?
Yes, if you are able to, you can continue to work from home.
Thank you so much.
Okay.
Thank you, Z. Go ahead.
Yeah. We have a question that was submitted ahead of time, and it says, we have shown we can do all our work from home in our department. Oh, I'm sorry, I'm reading the wrong one. How will technology needs be handled if staff work remotely part of the week? Some staff are using existing equipment that were on their desks in the office. Will we have equipment both at home and office to allow for a hybrid schedule? And I think Rose, you and maybe Dr. Sanchez might want to tackle this one.
Actually, if that is the case, I would recommend that you speak with your supervisor and let them know what the situation is, because we do need to plan for those circumstances and give direction on how we need to fill any gaps that may be out there. Dr. Sanchez, you want to add to that?
Yeah, I'll just add a little bit more detail. So we realize that we're going to need additional technology to be able to facilitate that support from working from home. So we're working with our IT department to try to procure additional computers. The challenge right now is everyone in the country is seeking computer technology as a result of having to work remotely through the pandemic. And so there's a shortage of inventory from vendors, including the vendors that we have historically worked with, like HP. So we're seeking out other opportunities where there's the ability to procure technology in order to support those requests. But if there's a request to do a hybrid working schedule, it's going to be important for you to communicate with your direct supervisor on what that schedule looks like.
Thank you, Dr. Sanchez. We have another one in the Q&A box. Will appointments be only for currently enrolled students? Dr. King?
Thank you, Zanetta. The appointments will be for students that are in classes and for students who are coming on for onboarding. If they have questions, et cetera, they can go through the process, but they have to go through the same protocols, the drive-through or the welcome back check-ins.
Thank you, Dr. King. We have another question here in the Q&A for Dr. Spradley. Classes from the MedOp program will be face-to-face in the fall semester? That's a question.
As many of them that can be face-to-face will be face-to-face. Those operate out of our center at National City, and some of them have been face-to-face already.
Thank you, Dr. Spradley.
Okay, we have another one. What if someone becomes COVID-19 positive? Is the campus shutting down again if one person becomes positive? So maybe Dr. King and Rose can speak to this.
Yes, I can take that one. Then Tina, you can chime in. What we do is, should we have a case on campus, that's where contact tracing kicks in. And we identify everybody who has been within the orbit of that individual and then isolate, work to isolate so that we can contain whatever situation may exist. It's a process we've been taking all along. And so we will continue in that process as we open up. There are certain protocols that we are to follow. Just so you know, there are protocols we follow as it relates to our public health system.
Thank you so much, Rose. And yes, we'll follow the same protocols from the county, similar to what we do for our TB protocols. And we would work closely with the county to determine close contact. And just so we're aware, close contact is more than 15 minutes less than 6 feet away.
Yeah,
No.
and I see a question in the chat where it asks, will the campus shut down? We don't actually make that determination. It's in collaboration with the county public health department on whether that the contact tracing necessitates for the campus to be shut down. Usually in those exposure cases, those exposures are within a limited area. So it doesn't require the entire campus to shut down, but if there's an extreme case, then the county public health department would issue that order.
Thank you all so much. I'm going to ask this question, VP Del Guadio, you did respond to this, but I think it bears repeating. The question reads, if I don't feel comfortable going back, am I going to be forced?
So let me first say that if you are feeling that, the first thing we're going to ask that you do is meet with your supervisor. We need to understand why it is that you feel that way. So meet with your supervisor. Let's ensure that there's a conversation, and from there, we'll see what we can do to mitigate the situation.
Thank you so much.
Okay, I'm gonna see this one. I'm not sure who this would go to, possibly Dr. King, I know Mikey is on this call too. Will the school keep a database of every student and visitor who comes onto campus?
Thank you so much, Zanetta. I'm not sure. All right, I'm gonna let Mikey go ahead and take that one. I see you turning.
Hi, everyone. Yes. The use of ServiceNow will be used to collect the people who are requesting to come on campus, daily check-ins, vaccination records received. So yes, we will have that information. And then any meetings that take place for using, QLS or whatever we decide to use, that will be another form of contact tracing as well. So we'll know who will be on campus.
Thank you, Mikey. We have another question. Are we still going to practice social distancing while on campus, even if the masks come off? Who wants to take that one?
So I get the nature of the question. I just think that one of the things that we've been following all along in this process is the science and the guidance provided by the CDC. So we're going to follow the language as that information continues to evolve. I think in terms of a best practice, we have been talking about creating the spacing through floor markings, et cetera, to ensure social distancing. So that's the planning that's governed our decision making up until this point. But really, as the science and the information continues to evolve, we could have a major breakthrough on June 15th in terms of that very guidance. But we're going to follow the recommendations of the CDC and our public health department on what that looks like for face coverings and social distancing. But at this point in our planning, we've maintained that as a part of our reopening plan. So, but it does require us to continue to monitor information that's being provided through our public health organizations.
Thank you, Dr. Sanchez. We have another question that's come in here. Is there an area where staff in student services would be able to take their breaks and lunch without using the student space? Dr. King?
A great question. We are still in the process of finalizing all of the spaces. Right now, there have been multiple proposals submitted. So more information will be to come about the outdoor space and where employees can be outside of our student spaces.
Thank you, Dr. King. We have another question. I think we somewhat answered it in one of the presentations, but this might give us an opportunity to expand. Will high traffic areas, student union, computer labs, libraries, etc., have limited capacity? And how will that be monitored and sanitized after each use? I think that's for Dr. King and Dr. Spradley.
I will address the library. Yes, capacities will be limited if that is what the CDC guideline has said needs to happen. Please be aware that we'll be following those public health and science guidelines based on the size of our facility. We are planning on having regular cleanings done. Again, we will be following guidelines as to how often things need to be cleaned.
Thank you, Dr. Spradley. Next question here for Dr. King. Who will be checking in students if they have an appointment with a student service department?
It depends on what department they're looking for, but if you're talking about the Cesar Chavez building, this is an example. The Welcome Center will be moved to the front of the building, and students will be checked in by our Welcome Center student service specialists, similar to when we're on campus, but we're routing them to the front of the building. And then we will use the QList software platform, or as Mikey shared, whatever we decide to finalize, go with. We'll use the platform to identify where the students should be routed.
Thank you, Dr. King. Rose, this one might be for you. This is about, we have various staff members with underage children whose school districts have not published their plans for the next academic year. How are we, if at all, considering working parents?
So if that is your circumstance, we're going to ask that you please meet with your supervisor and share what your circumstance is. And our hope, depending on the case, we're going to have to take these situations case by case. But our hope is that we will be able to find a solution so that the individual can, depending on the need, might end up working 100% from home, or might end up bifurcating their schedule on campus as well as at home. So have the conversation. If management has questions that they need to reach out to HR on, we're there to help support and provide guidance.
All right, thank you so much. The next question I think is for you, Dr. Spradley. Will the district be transparent with updates that are being addressed to ventilation systems as such Heck National City Dental before returning? I say this because there have been issues in the past with the ventilation system in National City Dental in last June 2020 when I returned on campus. Where there be air purifiers. Please, Dr. Sanchez, go ahead.
Janelle, can I take this one, please?
Yes, absolutely.
So the district has been absolutely transparent in the fact that a lot of work has been done installing MERV 13, which are hospital grade air filters in our HVAC systems. And I can say that because in the 12 weeks that I've been on the job, I've seen multiple communications from Dr. Hall and communications that I've sent out personally as a result of updates on our reopening plan. So we've been absolutely transparent on the work that we are doing and the work that we're continuing to do as it results to our HVAC systems and ensuring that we're getting clean air circulation through our buildings. And so I can't speak to what happened in June 2020, but all I can say is that our information that has been transparent over the last few months as our plan has been unfolding has been very, very clear and transparent as it relates to communication out to the district. With the MERV 13 hospital grade air filters, there is not a need for air purifiers in buildings because those systems have been scientifically proven to remove the virus particles out of the air systems. So that is our plan moving forward. We have been transparent and we will continue to be transparent with the district as we proceed in our reopening.
And may I add that both our dental hygiene program at National City and our public safety programs at Otay Mesa have been operating since last June, and we have had not a single COVID case because of exposure on our campuses. And the dental hygiene program sees patients. So I am very confident that we are operating very safely.
Thank you, Dr. Spradley and Dr. Sanchez. We have a question in the chat box. And this is the question of the hour, if the CDC and the state of California are issuing conflicting guidelines in the fall, do we know which organization's instructions we will follow? Dr. Sanchez, you want to take that one?
Yeah, and that's a great question because that's exactly in some cases what's been happening. I think what our practice will be is that we will follow the CDC guidelines or the guidelines through legal opinion that we've been able to ascertain that are actually the safest in terms of our reopening. And at this point, I would have to say that would be the CDC guidelines that we would be following. So let's hope that doesn't happen. Let's hope that they get aligned on those requirements, but we shall see.
Right, Dr. Sanchez and Rose, this may be a tag team effort. To understand further, staff is to report on August 2nd, but if some staff are waiting for FDA approval, and if it's not there yet, then they cannot come to campus, or can they be an exception as long as they agree to testing?
Yes, so good question. Thank you for asking that. Yes, if for some reason the FDA has approved the vaccine late and not in time for you to get the vaccine by August 2nd. What we're going to require of those employees is that they essentially engage in the same process as exempt employees, which means that you're going to be antigen tested twice a week, you're going to wear a mask, and you will be taking your temperature every day. So until your vaccine has gone through the process and has full efficacy, that's a process you'll undertake until you can produce a verification for your vaccine.
Thank you, Rose. I think the next question is going to be for you too. Is there a minimum amount of time classified staff are required to return to campus?
I'm not going to say there's a minimum amount of time. That I think is a decision that's going to be left up to the supervisor to determine what that amount of time is based on business need.
Thank you. Okay, and I think that is all the questions that we have. I'm just going to give it a minute to see if anybody has a burning question they want to put in our Q&A box.
Now's the time.
Okay, well, with that, I want to turn it back over to Dr. Sanchez.
Yeah, great questions. And we have a question that just came in. How are the restrooms will be handled when it comes to cleaning? I know there's a schedule of sanitation for the restrooms. I can't recall what that is based on the facilities. Did we determine that was going to be hourly?
Dr. Hall?
Thank you. So we are going to open restrooms according to so we're collecting schedules, and we'll know where the students are going to be and where the employees are going to be. And we're going to limit the restrooms that are open to those that are in the vicinity where there are people scheduled to be. And that's going to allow us to increase the number of times per day that those restrooms will be cleaned. As I mentioned earlier, we're in the process right now of hiring more custodial staff. And so I don't have a number of times per hour. It's going to depend on the people load. So how many people that are in those spaces, and then the cleaning schedule will be adjusted accordingly.
All right, that looks like all the questions that we have there. So with that, we're going to turn it back over to you, Dr. Sanchez.
Yes, thank you. Thank you to everyone for being involved in this process. I'll tell you, it's been an ever-changing set of circumstances, and it's been, quite frankly, very difficult to continue to adjust to the different guidance that has come about. And several questions alluded to that fact that there has been information that has been conflicting at times in terms of how we proceed on this. But I will say, and I think it's important for us to say this as college professionals, the world is opening up around us. We're seeing more restaurants open up. We're seeing movie theaters open up. We're seeing factors that are driving the economy opening back up. I've seen a lot of businesses with now hiring signs posted on them. So essentially the road is moving to opening back up. Southwestern College and the leadership has committed to doing it in a phased reopening. So opening up very carefully in terms of how we do this work. And I know there's a lot of questions and concerns out there around the health and safety, and we're going to continue to follow the best information we have in our planning. But I think it's important for people to also know that we've heard from a lot of our students in terms of being able to access services in person, because quite frankly, the online modality does not work for them. And so we know that for many students, online works for them because they have great internet connections, they have great computer technology systems, and also because they have the resources to be able to purchase those. But we also have many of our students who do not have access to great internet connections, who do not have access to great computer technology. Now, we've tried to bridge that gap by providing laptops and other technology solutions, but in often cases with many of our students, that still continues to be a problem where the connectivity is an issue. So our evolution to be able to adapt our services through a phased reopening to bring some of our services back to in-person delivery is something that's really important for us to be able to serve our community. And so as we continue to plan and get the best information possible, I just ask that everyone stay engaged in the process, continue to ask questions, because these are decisions that impact all of us. And so your participation in this process is critical. But I'd like to finish with the fact that you should really know that your leadership at this college is focused on doing it in the safest and most healthiest way to prevent anyone from being exposed or getting sick through the COVID-19 virus. So that's our commitment to all of you, and that will continue to be our guiding principles in our decision making. So thank you again for being a part of this process. We truly appreciate all of you.
Dr. Sanchez, would you be comfortable answering one more question?
I sure will.
All right. How will unvaccinated students who don't have transportation to get to Chula Vista campus 2 times weekly for testing then find transportation back to the centers where they have classes?
So that's a loaded question. Okay. Yeah. Go ahead, Dr. King.
Thank you so much, Dr. Sanchez. And so just so that you all are aware, we will be providing students with a list of, and I think I shared this already, but a list of free self-testing sites in the San Diego region. Students can even go to venues that are closer to their homes. They don't have to do the self-testing at the Chula Vista campus. They will just have to share their results, and by uploading them or when they come onto either of the campuses. So it may even work out better for them to go closer to their homes.
Thank you, Dr. King. And we have one last question for Dr. Spradley. When will the fall schedule be released?
Working on it as we speak. I'm hoping by the end of the month or sooner.
All right.
It'll be definitely out before graduation.
All right. Thank you so much. We have 3 minutes left here. We have another in the chat that's been submitted as well.
I can take that one.
Okay.
If you want to read it.
Oh, sure. We have some faculty who are adamant that they cannot teach while wearing a mask. Other faculty who are adamant that they will not teach face-to-face unless they are permitted to wear a mask. Will we be issued clear guidance on mask wearing while teaching?
So depending on what the CDC guideline is, there may or may not be a mask requirement. However, therefore those who do not want to wear a mask, assuming they are vaccinated, if they're not vaccinated, they have to wear their mask. Assuming they are vaccinated, then they can take their masks off while teaching. Those that are not comfortable and want to keep their masks on while teaching, even if they're vaccinated, they may do so.
So
I hope that helps.
Let me just be clear, though, that we are requiring vaccines upon return to work.
But if someone has an exception.
Oh, thank you. Thank you for that clarification.
Okay. The last question before we close out says, where are we going to be able to find the recorded session? So thank you. That's a wonderful ending question. The recorded session will be sent out by email as soon as it's available. I don't anticipate that to be longer than a day. I'm just not sure how quickly Zoom buffers and allows us access to it. But we will send it out on an all-campus email, so please do check your campus email. And with that, Dr. Sanchez, I think we can close out. Thank you, everybody, for attending. And we look forward to wishing you all a great summer, and we look forward to seeing you back in the fall. Bye-bye.
Thank you, Katura.